Yay! There we go. Hi, everyone. Sorry we're 2 minutes late. We had some technical challenges, but everyone's here, so we're really excited. Um, I'm Shannon, and this is Cheryl.
Nice
We're
to meet
both
you.
from the company 1104 Health, really on a mission to make clinical trials and advanced treatment options accessible to all patients. And part of this is arming patients with education and helping them navigate their journey. So today we have a webinar with three fantastic guests. There is an opportunity for Q&A. So in this platform, you should see a Q&A box or a chat. Either way, if you pose questions, we'll ask them live, or we can follow up with you personally to make sure that they are answered. Cheryl is a cancer survivor herself and our chief patient advocate, so she'll be handling all of the questions. And then we have Dr. Mei Firestone. She's a medical oncologist treating all types of cancer, and Dr. Claire Edwards with her, who is a breast surgeon. Both incredibly impressive and established, and we're really fortunate to have them today. And then we have Chantel Smith. She's on the board of the Loudoun Breast Cancer Network, an advocacy group that's helping breast cancer patients and caregivers. So she'll have, a unique and different perspective to provide. So I'll turn it over to Cheryl.
Well, thank you all for joining us today in celebration of National Breast Cancer Awareness Month. We are, want to really be careful to go over the patient journey. Getting diagnosis of breast cancer is very overwhelming. There's a lot of steps, a lot of things to consider through the diagnosis process. And we want to kind of just kick it off with both of the doctors and open up with, what do you think is the biggest gap that patients that are the biggest gap for patients upon their diagnosis? What is it that they don't understand when they find out they're diagnosed with breast cancer?
You are muted.
Oops.
You're still muted.
Can you unmute them?
I can't unmute them, but we could always pose one of the first questions to Chantel while it's working.
Yeah, exactly. So let's see. Let's go down here. So one of the I think problems when patients are diagnosed with any kind of cancer, especially breast cancer, what are the services out there to help me in my cancer journey? We don't realize that there's a lot of community services out there that can not only help you financially, but also help you, navigate getting to your appointments and offer resources for you in your community. And Chantel's organization supports breast cancer patients in Loudoun County, Virginia, and she's going to kind of give an overview on some of the resources that are out there. And there are also other community groups such as hers and Everybody's Community.
Thank you. Loudoun Breast Health Network, we have two main programs. And the first program is called our Pink Assistance Fund. That addresses the need that when you get a breast cancer diagnosis, that comes with additional finances, no matter what your insurance level is. So when somebody applies, we talk to them and say, what's hanging over your head? What is preventing you from just going full on in your treatment? It can be a variety of things: rent, medical bills, food, gas. So we offer some financial assistance that at least, helps them move forward. And that's just to Loudoun County. Then we have something called New Beginnings that provides. I personally will meet in our office, and allow people to try on wigs. They're free wigs, hats. We have somebody that can measure for mastectomy bras. Also, if somebody requires a breast form, if they didn't go through reconstruction and they would like something to just make them feel whole again, we will provide free breast forms that are fitted for them. And that we don't just limit to Loudoun County. So, I've helped people in other counties. We also have compiled a list of just different organizations that can help, whether it's emotional, rides, financial. So it's just a nice listing that breast cancer patients, so that they don't have to go out and Google and try to find all of those resources themselves. So that's what we do.
Great. Thank you, Chantel. And I for one had no idea that there were that many resources available locally when you're going through treatment. I think we have kind of cleared up our our audio problem. I want to now turn it over to the doctors. That being said, after your cancer diagnosis, it's very overwhelming. Most patients just hear, you have breast cancer, and they're feeling overwhelmed. What do you think is important as far as next steps and what they need to understand, what patients need to understand about their breast cancer diagnosis?
Yeah, no, sorry about technical issue. Technology, that's something that we are not experts in. It's okay now. Can you hear us?
Yes, we can.
Okay. Yeah, from a medical oncology perspective, I mean, we could talk about the patient experience in meeting with us, and we can talk about what typically happens when a patient makes a phone call or gets a diagnosis after imaging is done or biopsy or something like that. They might end up sitting in front of Dr. Edwards first. And so maybe you can talk about that, and I'll take it from there.
Okay, yes, so that is true. Can you hear me okay? I'm sorry. All right, our audio is still a little, it's all right. As the breast surgeon, oftentimes patients will see me first. That is because historically and still, usually surgery is the first step in breast cancer treatment, but that is not always true. Fortunately, we work together, me, Dr. Firestone, and the other medical oncologist at our practice, which is LBHN Cancer Center. And so since we're all under one roof, it's very easy to facilitate a patient seeing a medical oncologist in a timely fashion if they're in a situation where the oncologist really should be the first step, meaning that the patient actually needs chemotherapy at the first step. That is not the majority of patients, and it really depends on the type of breast cancer, the stage, but for more aggressive presentations of breast cancer, it would be appropriate to see the oncologist first. But regardless, oftentimes, because of the history of often the surgeon being the first person that patients see, I do tend to see a patient who is, yes, coming in with, as you kind of alluded to, not a whole lot of information necessarily coming in. And so I do tend to explain the pathology reports, what we know so far, what we don't know, the treatment for breast cancer with a very wide lens, that these are generally the options, and kind of talking in sometimes a very broad way until the patient can see other specialists, including the medical oncologist and the radiation oncologist. But just things like, for example, generally you have a type of cancer, breast cancer, that may or may not need chemotherapy. Here's how we decide. This is what we're going to find out next. I think one of the gaps is that I have noticed a lot is that oftentimes the good news is that breast cancer is now usually detected so early, or oftentimes, not always, but that means that it's detected through imaging, like screening imaging, through screening mammograms. And so the patient has gotten a lot done at a radiology center, which is great news on one hand because it helps, the patient gets a screening mammogram, it's abnormal, come back for further imaging, identify something that needs to be biopsied. The radiologist gets them in for biopsy quickly, and then they, but they haven't really seen anybody that gives them really the context of what's going on. And unfortunately, as wonderful as our radiologists that we work with are, I think there's not really a good way for them to communicate things in like a really comprehensive fashion, or like answer questions. And in some ways it's not their specialty really, and they don't know there's missing information. But that's one thing. Patients are scared partially because there's just like, they just haven't gotten the information. But certainly when we do get the call, as Dr. Firestone mentioned, we try to get patients in as quickly as possible, so there's just not too much like delay.
Right.
Just like show it up.
Now, Dr. Firestone, I think, can you talk to us a little bit about how the pathology and the different types of breast cancer dictates the navigation of treatment, and then moving a patient maybe on to considering a clinical trial?
Sure, absolutely. Just taking it from Dr. Edwards, sometimes a patient gets referred to me by Dr. Edwards, and we communicate all the time, which is nice. I think that's a real plus in our particular practice, and practices that have specialists that work very closely together, whether they're the same practice or just able to communicate and coordinate the care of patients quickly and responsibly. So that level of care, the multidisciplinary approach, is a really, really important one in the treatment of breast cancer. I think that helps alleviate a lot of the anxiety that patients go through, because they're able to see lots of specialists and coordinate that care. And they know doctors are talking to each other and making sure that their treatment, everyone agrees with that, moving forward in treatment. So when I meet a patient for the first time, sometimes it's after surgery, as Dr. Edwards alluded to, and sometimes it's before surgery. And breast cancer is an incredibly heterogeneous type of disease, and we're seeing that so much in lots of different types of cancer, but breast cancer for certain. And so it's not one blanket diagnosis. There's so much that goes into understanding the biology, and therefore then subsequently the treatment of breast cancer. So when a patient meets with me, I do spend a lot of time, and Dr. Edwards does as well, going through the pathology report and highlighting pieces of information there, because patients will read that. Sometimes they get the results before we do.
Wow.
Their doctors do, and they're reading it, and they're Googling, and they're freaking out. And so it's really important for us to go through that information with them and make sure they understand all those granular details, because they'll look at something and it'll say grade 3, and they'll be, oh my God, I have stage 3 breast cancer, I'm gonna die. And so really just kind of rolling them back a little bit, reeling them back in to say, look, here's what all this means. Here's what it means for your treatment. Here's what it means for your prognosis. This is what your actual stage is, and this is what we're going to do moving forward. So I think that's an incredibly important part of the discussion. And, these discussions are very lengthy, and they probably don't absorb maybe 10 to 20% of what I say to them the first time.
Yeah.
But we're happy to have those discussions over and over again. I think that has to happen. It's just too much detail. And it's the good and the bad thing about breast cancer that I tell patients. There's so much research that has gone into understanding how we take care of breast cancer patients. And a lot of that has been on the backs of clinical trials, for sure. But we know so much about how to take care of breast cancer patients. People ask questions, well, do you combine this therapy with this therapy? And what's the timing of doing this and that? There's been a clinical trial that's addressed all of those silly little questions, seemingly. So we know exactly what to do, and that's to everyone's benefit. But is there more that we can learn? Absolutely. As we uncover and peel back all the layers of what these different types of breast cancer are, we learn that there's more therapies out there. There's more that we can give to patients for treatment. There's more that we can do to cure patients. So it continues to be an exciting time in oncology, and that's one of the reasons I got into oncology, because it's never boring.
Right.
There's always something new. And so you asked about at what point would you offer a clinical trial for a patient? And patients ask that a lot. They come, they meet you for the first time, and they say, I have stage 1 breast cancer. Should I be enrolled on a clinical trial? In most cases, the answer is probably no. We've gone through so many iterations of how we take care of those patients that we probably are pretty good at that at this point. I'm not saying there's not room for improvement, but there may not be a whole lot to be gained from a benefit perspective for a patient from enrolling in a clinical trial. And there has to be some support financially for clinical trials, whether it's from investigational agent or from advisory groups and things like that. So the clinical trials that are out there now are looking at more looking at novel therapies. So really, we're enrolling patients on clinical trials that they've got a very aggressive form of breast cancer, like triple negative breast cancer, where we're not certain if standard of care is going to be enough for them. There's something just, biologically, we want to try something different in those patients to say, we're worried about your prognosis. We want to do something that's new and different. But a lot of times it's in patients who have metastatic disease or incurable disease and who have seen standard of care therapies already. And we're looking for something to try to get a better response, to give them more time to better their prognosis. And so we're trying novel therapies or combinations of therapies that are already out there that are novel that we didn't put together before. So those are situations where I'm often saying to a patient, it's probably worth evaluating whether clinical trial is right for you or not. Some patients just might want to enroll in like a registry trial. Say we're going to enroll patients, maybe they've got a little more unique kind of breast cancer, they're getting standard care, but we're going to monitor them and see what happens to them. And that'll give us information about what we can do for those patients in the future.
That's great. And as you said, it's a lot of information, and to a newly diagnosed patient, it can be really overwhelming. So I think it's important that you develop a good cancer care team. And if you can ask the doctor if you can maybe record the conversation and listen to it later, because they're going to throw so much information at you. And we all have our my charts right now, but that looks like a bunch of jargon if it's something you're not used to reading. But that explanation from your oncologist is like so valuable. And I think it's very important to have like a concierge, somebody that's going to come with you to your appointments and also be a second set of ears listening. And I'm going to throw it back to the doctors. What do you think a cancer care team should look like, or what, in best case scenario for you guys?
It's definitely going to involve the breast surgeon, at least to start. There's times when they've met Dr. Edwards and we find out that maybe they're not a surgical candidate. And so generally speaking, the medical oncologist ends up being the quarterback in a lot of these cases, or at least at the time of surgery for sure, or if surgery is not on the table. So breast cancer, medical oncologist, sometimes the radiation oncologist is involved. If we're talking about, locally spread breast cancer, curable breast cancer that's been removed, partial mastectomy or lumpectomy, radiation is involved to reduce the chance of local recurrence as well. So they're often involved as part of the care team. We don't have a radiation oncologist in our practice, but we work closely with some radiation doctors in the community, and we can put them very well and often. And so having doctors who have good relationships with each other, as I mentioned, whether that's in the community or academic centers, that exists all over the country. So you can definitely find multidisciplinary care teams that, whether they're in academic centers, they're also in the community. Other folks that are important to the care team, to Cheryl's point, it's good for patients to have someone with them, whether it's a friend, whether it's a family member. It doesn't have to be someone who's gone through cancer before, but that second set of years is critically important. There is so much information. There's people can misunderstand, or maybe there's miscommunications, and one person hears something different than another person hears. That's helpful. Other folks that I think are important to be involved.
No, I think you said it all really. The having a good radiologist a lot of times is important. Sort of a different role, not really an ongoing team member, but people are getting that follow-up imaging. Yep, we have to rely on the expertise of our radiology colleagues to tell us
for treating metastatic disease, how that's responding to therapy, if we're doing follow-up mammograms, are we seeing new areas evolve post-surgical change? So absolutely happy with radiologists available for us to help us.
Right. Yeah, and the other thing I'm going to throw out there, just because a lot of people research different levels of treatment option, things like nutrition or, Reiki or, acupuncture, like other avenues, has there been any scientific evidence that any of this will help increase a patient's odds through going through cancer treatment?
Oh, good. I thought it was something I forgot, but it's directly.
Oh, you can, sorry.
So, I mean, is it okay to just say like the specific oncology rehab and wellness is the practice, and
Okay.
it's been very great, and they've been helping our patients with just like lots. I mean, I don't have to get into all this because there's been like lots of physical therapy needs. That is not specifically Reiki and acupuncture that you asked about. I think that's actually
Yeah, I think it all. I mean, I just keep reading about a lot of nutrition stuff and all that, and I was curious, does that play into the cancer care team in any formal way, or is it everybody's just kind of out on their own?
Patients for nutrition consults a lot. I mean, when we give chemotherapy, we're causing a lot of disruptions to the body, and so nutrition is very important in our minds. Nutrition is important for wound healing. Nutrition is important for nourishing the body as it's being disrupted by treatments. And
Right.
so, actually, the oncology rehab practice has a nutritionist there, as well as patients that have consultations about diet and supplements and things like that. Is there any perfect diet for someone to be on to go through treatment? And from a prognostic standpoint, the answer is no. If we knew that, everyone would be on that.
Right. Now I just thought, I'd ask.
It has to be tailored to the patient. There's different people have different comorbidities, diabetes, high blood pressure, things like that, cholesterol, where they have dietary changes and restrictions that, I like to tell patients when they're going through chemotherapy, everything in moderation, but don't restrict yourself. Don't starve yourself. There's really not good data about starvation diets or ketosis. I've had patients who are doing that and say, I want to do this because I think it'll help, kill my cancer better, but really you're putting your body in a detrimental state where you're not being able to tolerate chemotherapy well. So I tell patients to avoid that. You hear the myth all the time about sugar feeding cancer.
Mm-hmm.
And it is, in fact, a myth because everything that we eat gets broken down into simple sugars. That's the fuel for every cell in our body. The fact of the matter is that cancer takes up sugar in higher frequency and higher doses, but that doesn't mean that you're preferentially feeding cancer by eating sugar. So, patients are metastatic disease and they're not having a little bit of ice cream at the end of the night or a cupcake or something because they're worried that they're going to feed their cancer. And I tell them, stop doing that to yourself.
Good to know.
Yeah.
Yeah.
So
so you asked something about acupuncture. I send patients for acupuncture a lot, actually. Sometimes it's not covered by insurance. But one of the things that I think is helpful for is neuropathy, which is nerve damage that can be caused by chemotherapy ulcers.
Okay. So before we kick it back to Chantel, there is one question from Q&A that I want to ask. It looks like it's just related to, it seems like when you get diagnosed with breast cancer, you're panicking a bit and you want to treat this as fast as possible. Can you just speak to the dynamics of, is it important to act fast, or is it more important and worth it to take your time and do all these tests to really understand the diagnosis?
I think you can do both. So, it can be tough. It depends on the location of patients in our particular area. There's lots of specialists. There's lots of doctors. There's lots of healthcare systems where patients are probably able to get appointments relatively quickly. But it does depend on the dynamics there. But you can meet with a breast surgeon or a medical oncologist, and they're going to be ordering tests. They're going to be gathering more information. I always tell patients we want want to make sure we have all the information we need to best take care of you. And that's where things come up about second opinions. Is it worth it getting a second opinion? Absolutely, it always can be. And so we're not offended if patients want second opinions. I always tell patients, make sure if you're getting a second opinion, you're getting it from an expert in the field. And I often will help patients get second opinions at academic centers. Relationship with Georgetown, having trained there. And so it's easy to get people in for second opinion consultations there as well. But, I wouldn't delay care necessarily. I think the sooner that a patient gets to meet a breast surgeon or potentially a medical oncologist, their doctor is recommending that, the better that they will get informed, because one of us will help explain what's going on and try to allay those fears and that anxiety about having a cancer diagnosis. There's no way around feeling anxious about it, for sure. But I think knowledge is power, and knowledge can be anti-anxiety.
No, I agree. I agree. Does anybody else on the Chantel or Claire, do you have anything else to add, or May?
I really, and I think it's just more as we're rounding out in the next few minutes. Of course, anyone who's listening, if you have additional Q&A questions you'd like to pose, please, put it in the chat, put it in the Q&A. But to Chantel, Claire, May, knowing that many people on the line it seems like we have a lot of caregivers actually that joined today, or, newer in their diagnosis or newly progressed, or even some nurse navigators actually are on the line today. What things would you want to tell to them in terms of what areas are important to get educated when there's so much going on? Maybe your closing thoughts on that could be helpful.
I would say just maybe like the source of information is the important one. There's a lot of information out there. Some of it is not good. Going to a website like breastcancer.org is an example. Another example is American Cancer Society websites. There's a website called breast360.org, which is from the American Society of Breast Surgeons. But just I think looking at something from a reputable website is great, but just be careful, source.
Yeah, I like the American Cancer Society, actually. They have a lot of well-written, patient-centric information, and it goes through lots of aspects of breast cancer. So you can get as little or as much detailed information written for a patient from the American Cancer Society website. So I like that one a lot.
Yeah, those are really good resources, definitely.
Yeah. Chantel, what about you?
I personally have not had breast cancer, but I lost my sister to it. And I could see from her point, she was single, and having somebody that could be with her, if I'm talking to, I'm sure, somebody that's on the support side, that was just invaluable. And it was a hard time to go through, but looking back, I was so happy that we were able to provide that with her. And even just, as we see anybody in the medical field, sometimes it is overwhelming, whatever diagnosis we receive, and having somebody just there so that, sometimes I can just, kind of black out or not process things. So whether it's, like you said, taping it, and also somebody there just to listen, not to provide it, but just to listen, is key.
Yeah, no, I agree, and I think we've seen over and over that patient outcomes are better. We get better patient outcomes, not only when a patient chooses to advocate for themselves, but when they have a team, somebody that's with them, helping them, coaching them, encouraging them along the way. And I think we as a team at 1104 Health are very, our mission is to help patients and local oncologists connect with the best cancer care, connection to clinical trials, to research. that can help your cancer journey. And you're not alone. There's resources out there. There's the doctor net community is huge. But don't be afraid to ask questions. No question is too stupid to ask. It's your cancer, it's your treatment, and you need to understand what you have and what you're fighting against. So I want to thank everybody for joining us today, and please feel free to reach out. We're here to help, and we really appreciate you spending the afternoon with us for 30 minutes.
Yes, thank you to all the panelists and to all the participants. Hopefully you found this helpful. If you have 1 minute to answer the poll question that pops up on the right of your screen to let us know if you found this valuable, it's very helpful for us so that we can continue to provide good education through these webinars. All right.
Thank you. Yeah.
Thanks, everyone.
Thanks so much.
Oh, that's nice. No one answered.